The African Medicines Agency is a specialized agency of the African Union, whose purpose is to provide leadership in improving the regulatory environment for the development of Africa's pharmaceutical sector. Its responsibility will include the development of common regulatory standards and harmonized legislation for medicines across Africa's 54 countries. It's modeled on the European Medicines Agency, and the function of the African Medicines Agency will include the development of pharmaceutical production in Africa, the evaluation, inspection, coordination, and sharing of information about medical products that are authorized for the African market. Fundamentally, the desire to create the Pan-African Regulator of Medicines, the AMRH, came from the need to address several critical issues that affect the timely availability of medicines to African patients and the quality of those medicines. First, there was a need to create an enabling environment for local pharmaceutical manufacturing, motivated by the challenge that Africa as a region has a very high burden of disease, 25% of the global burden of disease. The continent meets these medical needs by importing 99% of its vaccines and more than 95% of pharmaceuticals for 1.3 billion people. African countries found this situation untenable and believed that it kept the region's medicine supply chains extremely vulnerable to disruption and shortages, which in turn limited the availability of quality assured medicines that are needed by African patients. The agency was therefore conceived by the need to increase medicines availability and to create supply chain security in part through the production of medical products on the continent. And to manufacture quality, safe, and effective medical products, you need to have a regulatory environment that is capable of effectively overseeing the quality of that production. The second motivation for creating the African Medicines Agency was the need to reduce the timelines and cost of approving medicines in African countries. Safe and effective medicines already available in other markets often took a long time, between 4 to 7 years in some cases, before reaching African patients. An effective continental medicines regulatory body that is capable of supporting countries could help to reduce those timelines and perhaps the cost of regulatory approvals, and in turn improve access to medicines. The third motivation for creating the African Medicines Agency was the need to control the circulation of substandard, falsified medical products in African market. The weak regulatory environment caused by a variety of factors made it very difficult to police and prevent the circulation of falsified substandard medical products. This is in part the reason why the Africa region is affected by a high prevalence of substandard falsified medical products. According to the WHO quality survey, in some countries, quality failure rates of medicines that are circulating in the market can be as high as 28%, and the risk of harm to patients is immense. The result is a lack of predictable and consistent availability of medications needed by African patients. So the first concerted effort to establish the African Medicines Agency came in 2009, when African regulators came together to create the African Medicines Regulatory Harmonization Initiative. a partnership platform composed of heads of African Medicines Agency, geographical and economic groupings called regional economic communities, like the East African Community or the Southern African Development Community, SADC, and other partners. The treaty for establishing the African Medicines Agency was ratified in November 2021, and in June this year, Rwanda's Minister of Health, Dr. Sabin Nsanzimana, signed the hosting agreement with the African Union. And it's been exactly 2 years since the ratification of the treaty. I asked the current head of the African Medicines Regulatory Harmonization Initiative, Mrs. Chimwemwe Chamlimba, what progress has been made so far with the African Medicines Agency and what comes next.